The operation we do for the Gilmore's groin was developed by Jerry Gilmore in the early 80s, and we've modified it over the years to try and make it a better operation with a less recurrence rate and to make sure people get back to fitness fairly quickly. Now, to talk about that, you've got to think about how the muscles around the tummy and in the groin work, and there are three layers. There's a layer called the external oblique, and that sort of comes down like that, and in men there's a gap in that because all the cord structures come down to the testicle. Now in women that's a smaller gap, but it's still there. And then there's a layer inside that, and there's another layer inside that, and what happens is these muscles tear and they don't heal. So the archway gets pulled apart, and then the middle layer that normally sits like that gets pulled off a ligament called the inguinal ligament. So normally, if you examine somebody and you have to sort of put your finger through this ring in the groin, you would normally feel the middle layer, but because that's gone, you feel the back layer, and when they cough, that back layer bulges. Now this is why some people call this a hernia. It isn't really a hernia, because a hernia is a hole in the muscle, and this is just torn muscles. So sometimes it's called a sportsman's hernia or a footballer's groin. But really, if we call it a Gilmore's groin, people know exactly what we mean, because it has a specific sort of person that gets it, specific symptoms and signs, and specific change on MRI scan. So I think, although people try not to call it Gilmore's groin, I think that's still the best term because we know exactly what we're dealing with. So what you do when you do the operation, you've got this floppy layer at the back which you tighten up. You move this middle layer back down onto the inguinal ligament, as it's called, and you tighten up the front layer, so you tighten up this archway. And the final thing you do, because one of the problems you get is this ligament that runs along here gets quite tight, so you just release it and take the tension off. And that combination of releasing the tension and putting the muscles back is what allows people to get back to playing their sport. And if you've got a professional player, you can get them back in 4 weeks. If you've got somebody who plays at weekends, they're going to be longer, it's going to be 6 or 8 weeks. But using that technique and using stitches that all dissolve, so eventually there's nothing left apart from the person's own muscles. Certainly no mesh or plastic, nothing like that. That doesn't help in this condition. So we'll get just over 90% of people back to doing exactly what they did before, and usually in 4 to 8 weeks.